Hello and welcome to our video on the Michigan CNA State Exam, where we're going to be doing a very brief overview of what is on the state exam and what it consists of, and then we're going to dive into the knowledge exam, where we're just going to give a brief overview on what to expect for the knowledge exam on the Michigan CNA State Exam. Let's get started. All right, so the first thing I want to dive into is just an introduction to the state exam as a whole, and then we're going to dive into the important parts of the knowledge exam. So as a reminder, the Michigan Nurse Aide State Exam is a two-part exam that consists of a knowledge exam as well as a skills exam. The exam is hosted by Headmaster and TMU, and it is required to become a certified nurse assistant in the state of Michigan. You do have 24 months from your graduation date to complete and pass the testing. You can take the state exam up to 3 times per section within this 24-month period. So once again, 3 attempts for the knowledge, 3 attempts for the skills test portion of the state exam, and you have to complete it within 24 months. If you do not do those, then you will have to go back through a state-approved training program to try again. The cost of the test is $175, and it is payable at the time of booking in order to schedule your test. In the event that you were to fail the knowledge or the skill portion of the exam and you want to apply for a test, you'll need to pay for the portion of that part of the exam that you failed before you can schedule a new exam date. So once again, just wanted to cover some brief information about the state exam and that it is a two-part. But as we move on here, we're just going to be talking about the knowledge exam portion for you. All right, now let's dive into the knowledge portion of the exam. So the knowledge exam does consist of 65 multiple choice questions, and you have 60 minutes to complete all questions. In order to pass, you do need a score of 74% or higher. You do have an additional option for the knowledge exam. It is taken on the computer, but you have that additional option to add an audio or oral option as well. And that's where you'll have a wired set of headphones, and the questions can be read to you as well as appear on the computer screen for you if you feel that would benefit you. You do have to sign up for that and follow specific instructions for that portion of the exam if that's something you want to add on, but it's definitely there and available. When you check in for the test event for the knowledge exam, there will be knowledge test instructions provided for you in the waiting room to read, just to help you feel a little bit more comfortable and confident when you get ready to take the knowledge exam. So the biggest question we get from everybody, what's going to be on the knowledge exam? Like, what kind of topics is it going to cover? How much of each topic? How should I study, etc.? So the knowledge portion of the exam is going to have several different topics. You see them all listed right here on the slide. So aging and restorative care, basic nursing skills, impaired care, communication, data collection, disease process, infection control, mental health, personal care, residents' rights, role and responsibility of the CNA, safety are all topics that we're going to see on the state exam. You'll notice in here that there's parentheses with different amounts of questions in by each topic. So that will be the amount of questions on each topic. So for example, basic nursing skills is going to have 10 questions. That's going to be a heavy topic on the CNA knowledge portion of the state exam. Infection control is going to have 7. We're going to have things like disease process and data collection, impaired care that are only going to have 3 questions. But it's important to note that all of these topics will exist on the state exam, and this sort of helps guide you as you're studying and going through the process to prepare for the knowledge portion of the state exam. You sort of know, what's going to be a little bit heavier, what's going to be a little lighter, and where you should be concentrating your efforts at. Lastly, I just want to dive in on where you can take your knowledge exam. So you are able to complete the test on a computer at a regional test site, or you can also take it from home in the form of a remote proctored exam that is available. And what that looks like is, as long as you meet the technology requirements that are listed by Headmaster TMU, then you can go to your house and take it as long as you have a distraction-free place where you can get in and log in to the video conferencing app that they choose to use on your own without assistance. And once again, you meet those technology requirements. It's an option that's available. A lot of people like this because it's a little less intimidating than going into a testing site that is a little bit more formal. You are on camera. You do have to show the proctor, your area, and have the camera on you during the entire test. So that is something to be aware of, but a great option for those that want it. You don't need any prior computer experience either. It's very simple. You use a mouse to select your answers and to click next. So just sort of a general, once again, overview, very brief on what to expect for the knowledge portion of the state exam.